All right, so let's get started. So this is going to be our workshop for understanding asthma. So hopefully by the end of this session, you'll kind of get a good understanding of what the lungs do in our body and how asthma kind of interacts with our lungs to make it harder for people to breathe. And then also at the very end, we'll have a little hands-on activity for everyone to just really support their learning and get to know through a more interactive style. So hopefully you guys will all enjoy that.
Hi everyone, my name is Micah and I'll be introducing to you about how our lungs work. And so lungs are these organs in our body that help us breathe in and out. And so we breathe oxygen in and then we breathe carbon dioxide out. So breathing in is called inhaling and then breathing out is called exhaling. So how do we breathe in and out? First, we inhale air through our nose and our mouth, and then air travels down a tube called the windpipe or a trachea, as you can see in the picture here. And then the trachea connects to these smaller tubes called the bronchi, which enter each lung, and that's how the air enters into our lungs. And so what is asthma? Asthma is a condition where the airway becomes narrow, and this makes it a lot harder for people to breathe. And so people with asthma can have an asthma attack, which makes them feel like they have a hard time breathing or they're wheezing, or they could also have a cough. And an asthma attack can be caused by a lot of different things, as you can see in the graphic over here, such as exercise or irritants in the air. And there are special types of medications that can help with opening up these airways during an asthma attack, and then other medications can help prevent future asthma attacks.
And I'm going to be talking about inhalers, which is a way to get the medications to your lungs to prevent and relieve asthma attacks, which, like Micah said, includes shortness of breath, wheezing, coughing, or tightness in your chest. So generally, there's two kinds of inhalers. We have a maintenance inhaler and a rescue inhaler. So this slide gives you a general overview of the difference between these kinds of inhalers. But everyone's different, so make sure that you contact your provider or your doctor if you have any specific questions about your specific treatment for your asthma. So maintenance inhalers, they should be used every day, even if you don't have any symptoms for your asthma. They work in the long term to relax and reduce the swelling in your airways and those bronchi in your lungs so that you can breathe easily and so that you don't experience an asthma attack. This will also help you when you're having trouble breathing and reduce the pain and the difficulty it is to breathe. But when you need a rescue inhaler is when you have an asthma attack, when you do have that shortness of breath and that chest tightness, wheezing and coughing. So, and when you feel like you need relief as soon as possible. And so that's when you use your rescue inhaler. They work within minutes to relax your airways, but only temporarily give you relief. And only use it when you're experiencing these symptoms. So to summarize, maintenance inhalers, you should use them every day, and they're for the long-term use. And rescue inhalers are when you need relief as soon as possible, temporarily.
All right, so all of us that have been speaking are actually student pharmacists at UCSF. So we are trained in how to use these medical devices called inhalers. So I actually have one example here. We do have different kinds of inhalers. Hold on, I'm just gonna turn off my background so it's more clear. There we go. So this is what an inhaler might look like. There are different kinds, of course, but this is the kind that's pretty normal for people, an introduction to inhalers. So you might see maybe a friend at the playground, they'll pull it out if they need to breathe and they'll use it real quick. So this is kind of what they look like. If you ever see it, now you know what they are. So I'm just gonna go through a quick walkthrough about how you might wanna use the inhaler. If that is something that you do have in your possession as well. And these instructions are very general. So of course, look at the specific instructions that come with your specific device, but this is just a general overview. So of course, we're going to take the cap off like this, and this is the mouthpiece that we're going to put into our mouth so that we can inhale. Now in this section right here is where all the great medication is, the medications that do help us, as Jethro said, open up our lungs and make it easier to breathe. So we want all of this medication when we press down to go straight into our lungs and, do their thing right there where we really need it. So it's very important that you breathe a little bit out first and then press down on this button and then slowly inhale all the medication into your lungs. A common mistake is that if you go too fast, will go too fast and then hit the back of your throat and not reach your lungs. So it's very important that you go nice and slow. And once you inhale slowly, you'll hold your breath for around 10 seconds and then exhale it out. So that's just very common for a lot of different inhalers. And if you look at the right of the slide, there's also something that we call a spacer. And this is a spacer that we actually use for a lot of our younger asthma patients as well, because what the spacer does is that once we attach it like this, nice and tight here, once we press down, all the medication gets suspended in the air in this tube. And then once we take this cap off, you can inhale it at your own pace. So you can inhale deeply and slowly to the best of your ability, hold your breath for 10 seconds, and then exhale slowly. And hopefully all of that great medication will go right into the lungs for when you do need to use it for asthma. So that is a brief overview. If you have any other questions about like your specific inhaler usage, of course, go ahead and reach out to your doctor. They'll be able to provide better information specific to you. But this is just, again, as I said, general knowledge. And it's very important also that when you do use the inhaler to not look down, because that'll also prevent the medication from reaching your lungs the way that it should. So now we're going to go and move on into our activity. Hopefully you all had a chance to look at the different materials that we'll be using today to make our model lungs. And our lovely pharmacy students will also go over and walk through the process of how to do that with you. Is it okay if
Yeah, go ahead. It's not working.
Hi everyone, how's everyone doing? So let's go ahead and bring out everything that the supplies we need for the lung model. So we will be needing 2 plastic bags, 2 long straws, tape or glue, scissors, and then printable templates for your lips and the lungs. Does everyone have that ready? All right, so let's go ahead and cut our lung first. All right, so let's go ahead and cut the lips next. You want to come and join in mine? Okay, so next we'll take our 2 straws and then join them together so the L's are facing downwards, and then tape it together like that. So both of your L's should be facing downwards, and then you take another piece of tape and then
You loop it around so you can make a little double tape almost, just like that.
and then put it on the back of your lips and tape it in front of the straws like that. So now you have something like this.
Background. We're just going to turn off the background so you can see it really quick.
So it will look something like this, the L shaping downward and the lips on the top.
And then after that, you would get your 2 Ziploc bags of choice, preferably the small ones so we can mimic the lungs. And you would cut just the top part, the part where the zipping part, remove that. Cut your second one.
So now you have something like this without the green thing on the top. And now let's go ahead and jumble them together and then put it on top of the straw and
You
tape
want to
it.
make sure that it's tightly secure onto the straw. So then that way, that. And then you can secure it again with another piece of tape. And squeeze.
Yep, this one's done. And do the same thing with the other Ziploc.
Scrunch it together. And for this part, it might be easier to have someone help you as well, so they can hold it for you while you tape.
So our last part is taping the lungs together. So just tape it on the back side like that.
And again, you can make a loop with your tape, like that.
And there you have it, a lung model. So next, we got our lung model. So just blow into the 2 pipes and see the lungs, the Ziploc bags expanding. So that's how you breathe in. And then when you breathe out, it goes back to the empty Ziploc bags and you could just play with it.
This would be exhaling.
Yeah.
We hope you enjoy this activity. If you have any questions, you can definitely let us know. But this is what the lung model, it's mimicking our actual anatomy of our body. We hope you have fun making these.
All right, thanks so much for that demonstration, guys. So another fun thing that you guys can do when you do make your lung model, or if you have it now, is that if you actually pinch the straw in the middle, that'll make it seem like the straws are more narrow, right? So if you try to inhale and exhale that way, it's not quite like what what a person with asthma might experience, but because the straws are more narrow, you can kind of see how it's harder to put that air into the lungs and into the bags itself, and it's harder for it to expand if you do it like that. So that's also something fun that you guys can try with these lung models. Does anyone have any questions for us about the activity or about the lungs in general or asthma in general? All right, well, feel free to go ahead and ask us. We have actually, I'm not sure if we have our emails on the slide, but our information is listed on the event activity page on the BASF website. So feel free to reach out to us at any time for those information. On our event page, organization page as well, we do have a few supplemental materials just for if you want to know more about nutrition, how to balance a healthy diet, and then also some information for that's easily digestible for families and kids and for adults as well about COVID-19 and what this pandemic means for all of us. So feel free to go into those links to learn more about those topics, and feel free to ask us questions about those topics as well. All right, so we have a question in the chat. Thank you, Steve, for submitting the question. So it's, how does diet affect asthma? So let me go ahead and go back on the slides here. So if any of my other co-hosts want to join in on this topic as well, feel free. My answer might not be complete. But in terms of diet specifically, there are certain foods that will definitely be a trigger to certain people. And of course, that's very on an individual basis. So that is something that you would want to be mindful of, be aware of. And for a lot of people, the hardest part is kind of figuring out what might be a trigger and what might not be a trigger. So that is something to take into consideration. In terms of asthma as a condition as a whole, it is an inflammatory condition. So I think Jethro had touched on it earlier that it's actually the lungs kind of become inflamed, and it's a chronic inflammation that happens as well. So the diet actually doesn't do too much in terms of treating it or helping it go away. It's really these medications that we give that expand the airway or target the anti-inflammatory treatments for it. Hopefully that answers your question. But yeah, if anyone else wants to jump in on that as well. There seems to be another question. So I've never seen the extender. Why would I need one or want one? So I have the extender here. It's called a spacing device, and we like to prescribe it and give it to people that might have a hard time timing the pushing down of the inhaler button with the inhalation of the medication itself. So without this inhaling device, you actually do have to coordinate it. As soon as you press the button, you need to inhale for those 3 seconds and hold it in like that. So if you don't time it well, then the medication's either not going to hit where it needs to go, or maybe it'll get stuck in kind of your mouth area. So when you do use the device, and we do recommend it for kids or people that can't take that deep breath in the beginning, a slow deep breath. So when it does get suspended in here, you can take your time, take a few breaths, maybe 2 or 3, just to get all that medication inside into the lungs. So the timing issue is definitely resolved by these spacers, and I would highly recommend it for younger kids that, you know, can't do the timing as well. So just one push into here, it'll just be suspended and they can take it however they need to on this other side in 2 or 3 breaths, nice and slow. All right, another question is, I've heard firefighters may be affected by poison oak and developing asthma. Isn't poison oak a skin problem? Okay, so with poison oak, it is a poison. So a poison is anything that can irritate your skin or just anything it touches, right? So with asthma, it is inside our bodies, but because it does bring in air and potentially other particulates in as well, it technically gets exposed to the different contaminants in the air. So I'm not too sure exactly about poison oak, but my guess is that with the poison oak in fire specifically, the oils in the poison oak might get released into the air. And when firefighters breathe those in, those tiny little particles that get breathed in will irritate the lungs because that's straight where they're going with the air into the lungs. And it's going to be small enough that it might cause irritation. And it is poison, so not great to get into your body in the first place. Going off of that, the asthma, that's also why with these fires going around in the smoke, it's very dangerous for people that do have asthma because the small smoke particles in the air also get breathed in into the lungs and kind of get trapped there. So a lot of times people will have worsening asthma when these smokes, when the smoke does come around, and even with pollution, heavy pollution.
Just adding on of that, even when you inhale the oils from the poison oak, it could irritate your nose or your mouth when you breathe in and cause rashes on the skin of your nose inside. So that can cause breathing problems as well, which could lead to asthma.
All right, I'm loving all these questions. Keep it coming. We still have a good amount of time. So isn't it also important for kids to use the spacer so they don't develop oral thrush? Yes, absolutely. So if anyone doesn't know what oral thrush is, it basically is what happens when the medication is not breathed in properly and goes to the lungs. That medication might get trapped in the mouth or the throat area, and it causes kind of like this little inflammation. It's almost like a rash, but inside your mouth, which sounds very uncomfortable. So the spacer does help. Again, it's by using the spacer, you can kind of take your time and breathe as you would normally, in a sense that you can time it for yourself and to your own comfort. So then maybe if it's harder for you to breathe in using this device by itself, this will give you more time to kind of adjust and breathe in deeply so that the medication reaches the lungs and doesn't get trapped into the mouth. Another kind of piece of advice that we do give to prevent oral thrush is just to brush your teeth after using it as well. That's not always something that we can do if we're at school or at work, but it is definitely something that can help with the potential of developing thrush. Okay. So another question is, what are the adverse effects, if any, if patients use the rescue inhaler for long-term conditions instead of for temporary relief? All right, so I think Jethro did talk about this a little bit, but it's a great question because it is something that confuses a lot of people. The rescue inhalers are actually made of a different type of medication than those long-term maintenance ones that may contain anti-inflammatory effects. So earlier I did talk about how asthma is a chronic inflammatory condition. Basically that means for a very, very long time, your lungs just become very inflamed or red or puffy, and just the tube itself gets more narrow. So the rescue inhalers, those of course give that instant relief of opening up that airway very quickly, but the inhalers that do contain the anti-inflammatory effects are the ones that will target the problem itself at the root of what's causing the inflammation to begin with. So there's a lot of different types of anti-inflammatory inhaler medications, and that just varies, depends on what your doctor kind of deems is best for your condition, because everyone's condition is so different. The way that they might want to target your asthma is also going to be very tailored towards your own health and your own activities, and just a well-rounded approach. All right. So we do have 3 more minutes left. This is probably going to be our last question. So has there ever been a death caused by asthma attacks? You know, I'm actually not completely sure about the exact numbers and the like the rates of death caused by asthma attack. I do believe that it's possible if your lungs get so inflamed that no air can come into it at all, and the person doesn't have access to the medical care that they need, emergency medical care, to help open up those airways, or an inhaler to open up the airway. It's entirely possible that if they don't get enough air to the lungs can't move that air to the rest of the body, specifically like the brain or the heart, which are the areas that need oxygen the most, then I could see it becoming a very big problem for that person who might have an asthma attack. So it is a very serious issue, and that's why we always tell our patients that do use inhalers to be very on top of it. When if it's something that's prescribed every day, then they should take it every day. And if it's just if they need it, then it's use only if they do need it. So I see that there are some other questions, and I'll try to go through it. We still have 2 minutes. All right. So a question from an attendee. I have heard that the albuterol in the inhaler is bad for your teeth. We try to at least rinse after the inhaler. Is it important? So I'm actually not sure if it's bad specifically for your teeth, but we did talk about brushing your teeth to get rid of the medication in the mouth area to prevent that, that thrush where it's just red and puffy and uncomfortable. I'd have to look into teeth specifically. Someone else asked, can asthma go away? So I don't believe that there is a cure for asthma, but a lot of people have asthma and they are very good at managing their asthma by using these medications, these inhalers. So with long-term use of the inhalers, you can have completely 0 symptoms and live your life very normally for a very long time, obviously, as long as you continue to use these inhalers as your doctors tell you, and as well, it'll keep those symptoms from showing up and making your life harder. In terms of going away permanently, that's not something that we see very often, I don't believe. Yeah, it is a chronic condition. Let's see. Our doctor told us that the other chemicals in a rescue inhaler contribute to hyperactivity. True, the nebulizer medicine has less chemical additives. This one I'm actually very not sure about. If you want to send one of us an email about that question, we can get back to you and talk to our actual pharmacist preceptors to see if that's true or not. But yes, please email us. We are out of time now. Thank you so much, everyone, for joining our little asthma workshop. And I hope you guys learned a lot, or this sparked some interest that you guys can do some further learning and further activities. But yeah, thank you so much. And we hope you guys can attend some of the other workshops as well. There's a whole bunch this year on the virtual platform. So yeah, thank you and have a great rest of the day.